Let's talk about left ventricular failure. So this left ventricle here is a pretty prominent, pretty important piece of the body because it's going to be pumping blood through this aorta and through the body. But the problem is when we have a myocardial infarction or some sort of ischemia or infarct that occurs here, this tissue starts to die. It infarcts. But it doesn't just get disappeared, it doesn't get broken down, it simply becomes scar tissue. And scar tissue can't expand, it doesn't have any elasticity, it doesn't have the ability to contract anymore. So our body is suffering because we have less muscle that can move blood. So what does our body do? Well, our body starts to generate more muscle, starts to build more muscle, but it doesn't do it on the outside, it does it on the inside like so. So we start to generate more and more muscle, make these walls thicker. But the problem is, as we do that, we start to make this chamber smaller. So even though we have more muscle, these new muscles have to work even harder to push blood because it has to do it that much more often because there's less fluid per contraction.